Hello everyone and good evening. This is Kevin welcoming you to yet another brand new episode of BMC Global Live AlHilal Health World, Nothing But Lifestyle. As you all know, this is an exclusive talk show with the doctors of AlHilal hospitals and medical centers. Today, we have with us the ENT specialist from AlHilal Hospital, Hind, Dr. Hemanth, and we would be discussing about Epistaxis. Hello doctor, welcome to the show. How are you doing?
Thank you so much. I'm good. How are you doing?
I'm doing wonderful. Thank you for being on the show with us.
Thank you for hosting me on this show.
Wonderful. Today we are going to be talking about epistaxis.
Yes.
So would you give us an insight about epistaxis, please?
All right. So epistaxis, on a layman's term, is just nothing but nasal bleeding. So nasal bleeding is basically caused because of the rupture of the blood vessels of the nose. So it produces a sudden gush of bleeding from the nose. And it is one of the common presenting features for an ENT surgeon. But for a layman or a person who is just coming to me, it can be a horrifying episode wherein suddenly when the patient is there who is normally playing, or a child who is normally playing, suddenly is having a bleeding from the nose. The parents are scared, the child is also scared, they don't know what to do. They just rush to the hospital with the child bleeding all over the clothes and face and everything. So my intention of doing this talk today is to tell the viewers or guide the viewers on basic first aid which can be done at home or the place where the child is having this bleed, so that most of these episodes of epistaxis can be controlled at the site where it has happened. And just to give you an insight, 60% of the population can have at least one episode of bleeding in their lifetime. Although this number might seem very large, I can tell you that only 10% of people who bleed actually require medical intervention. So most of it can be managed easily at home.
So doctor, in what age group of people can we see epistaxis?
Okay, so epistaxis usually occurs in two broad different age groups. One in children between the ages of 2 to 10 years of age, and the other in adults between the age groups of 40 to 80 years. So based on the type of occurrence, epistaxis can be of two types. It can be either anterior epistaxis, which is bleeding from the front part of the nostrils, or posterior epistaxis, which is bleeding from the back side of the nose.
Okay, so doctor, what is the difference between anterior and posterior epistaxis?
Okay, so anterior epistaxis is one of the most common types of epistaxis which we encounter, and it is usually seen in the child age group between 2 to 10 years, as I have told you. So usually what happens is the children have this habit of picking their nose or scratching the nose, and that is one of the most common causes of this anterior epistaxis. And the blood vessels here in this region are very thin and easily traumatized, so it can cause this kind of a bleeding. And usually the bleeding in anterior epistaxis is usually from one nostril only, and it is usually occurring from the center portion of the nose, which is known as the septum. So that is as far as anterior epistaxis is concerned. Now posterior epistaxis is most commonly seen in the elderly groups of age between 40 to 60 years, and it can occur because of some comorbidities like hypertension or cardiovascular disease. And usually the bleeding is seen in the back part of the nose, and it is seen from the side walls of the nose rather than the center of the nose. And this blood is not like anterior epistaxis coming out from the nose, but more commonly it goes backside into the throat, and bleeding can happen from both sides as differentiated from the anterior type. And usually the patient can present with having tasting of blood, or unconsciously when he swallows the blood, he can produce vomiting of this blood, which is again a scary episode, and they can present to us in that sense.
So doctor, what are the causes of epistaxis?
Yes, broadly epistaxis can be classified into different causes like local causes, systemic causes, environmental causes, and drugs induced epistaxis. So, local causes include, as I told you, most commonly nasal nose picking or rubbing of the nose. Nose picking is more common in children, whereas rubbing can happen in patients with allergy because of the constant itching sensation in the nose. They tend to keep rubbing the nose like this, and that irritation can produce epistaxis. Children, another thing is foreign bodies in the nose. Because of the constant irritation of the foreign body which is stuck there in the nose, it can produce. So, I have this dictum in children: whenever a child comes to us with a unilateral or one-sided nose block which is causing a foul smelling discharge, always we need to rule out a foreign body inside the nostril. Other causes can include facial trauma, especially it is common in professional sports like boxing or any kind of sport in which their protective gear has not been used and it causes injury to the face, can produce nasal bleeding. Other causes include deviation of the nasal bone, which is an anatomical defect, and because of this deviation there could be small sharp bones which is protruding in the nose and causing epistaxis. Rarely it could be also seen in tumors of the nose which can cause bleeding, and also in a recreational drug abuse like patients or persons who snort cocaine regularly can cause epistaxis. Systemic causes of epistaxis include comorbidities like hypertension or cardiovascular diseases. It could also be occurring in persons who are already prone to bleeding disorders like hemophilia, or it could be also seen in chronic alcoholics. Now, what happens in alcoholics, chronically abusing alcohol, it causes damage to the liver, which produces a fatty liver and eventually cirrhosis of the liver. Liver is an organ which produces certain enzymes which help in the clotting of the blood. Now, when this liver is damaged because of chronic alcohol abuse, it can produce or it can have the absence of these enzymes, due to which even minor traumas in alcoholics can produce sudden gushing of blood, and this may require medical intervention also. Then there could be environmental factors of epistaxis. Mainly it is seen in dry or very cold climatic conditions, and also patients or persons who are constantly using nasal decongestants or nasal sprays, and it is usually used directed towards the lateral aspect of the nose, but constant usage of the sprays which is directed towards the center portion of the nose produces dryness of the septum, and this can cause nasal bleeding also. And finally, drug induced causes of epistaxis. Mainly it is because of the usage of blood thinners which are used in cardiovascular problems. Other causes of drug induced epistaxis could be constant usage of NSAIDs or painkillers like aspirin or brufen. Also, persons who are using certain homeopathic or herbal medications like ginseng can also produce epistaxis. So, these are some of the causes which could lead to epistaxis.
So, how can we treat epistaxis at home?
Alright. So, epistaxis, as I told you, it could be a very horrifying episode when a caregiver or a person who is looking after someone suddenly sees someone having spontaneous bleeding from the nose. So, the most important thing I need to tell the viewers is that do not panic. It is something 90% of the causes of epistaxis can be controlled just by certain first aid remedies which I would like to share with you today. So, what you need to do first, whenever you see a person who is having bleeding from the nose, make the person sit down comfortably first and ask them to pinch the nose like this and bend forwards, and then ask the person to breathe from the mouth. Also, you can give the person a bowl so that whatever blood is coming from the into the throat can be spat out into the bowl, and keep a ice pack over the bridge of the nose. So, by using this maneuver of pinching, it basically compresses the blood vessels of the nose And when this is done for a period of about 5 to 10 minutes, usually 90% of all the blood bleeding will stop. And this itself could help to prevent further episodes of epistaxis, and there is no need to actually have a further need to check in the hospital.
So when should a person seek a doctor's help for nasal bleeding?
Yes. So as I told you, 90% of the cases would the epistaxis would usually resolve by these first aid measures. But in cases where there is repeated occurrences of epistaxis for several times, epistaxis which is not stopping by using these first aid measures, in persons who are already using certain blood thinners or tablets for cardiovascular diseases in whom the bleeding is not stopping, or persons who are already prone to bleeding disorders like hemophilia, these patients require certain further maneuvers to stop their bleeding. Also chronic alcoholics. These are the patients in which the bleeding is not going to stop just by these first aid measures, and they would require further intervention. So these are the group of patients which need to be seeking medical intervention.
So doctor, how is epistaxis managed in a hospital setup?
So as I told you that 10% of the patients who are actually coming to seek help for us, so what they need to, what we do in the hospital setup is, first when they come to the emergency, it is already a horrifying sight to see a child having continuous bleeding and all their clothes are stained with blood. So even the persons who are in the hospital, when they see this, it is kind of shocking or a horrifying incident. So we need to make the person first sit comfortably. We will first check their blood pressure or pulse to see, especially in an adult, if there is any raised blood pressure which could be triggering this episode of epistaxis. Once that is there, if there is a profuse bleeding from the nose, then what we do first is we need to do something called as a nasal packing. So ideally this can be done either by putting a ribbon gauze into the nose, or recently we have these nasal tampons, which is just a small piece of material which is just put into the nostrils, and this helps to absorb the blood and gives a pressure over the blood vessels and helps to control this bleeding. And most of the cases with this much, it usually stops. But in some cases when the bleeding tends to continue, we need to do further investigations. We may have to take the blood test to check if there is any bleeding disorders or if there is any infections which could trigger this kind of bleeding. Also we do something called as an endoscopy, wherein we pass a light into the nostrils and check if there is any bleeding point. If there is any bleeding point, we do something known as a cauterization, wherein we use either a chemical or an electric current to cauterize that particular area of bleeding. Also in cases where there are tumors in the nose, we need to probably excise the tumor, or we may need to ligate a particular artery so that this bleeding stops. And lastly, if the patients are having a deviated septum which is especially causing a poking on the nose, then we need to correct that septal deviation to control this epistaxis. So these are some of the measures which we use in the hospital setup.
So doctor, how can we prevent epistaxis?
Yes. So as the saying goes, prevention is better than cure. So certain things that we need to take care is, especially when there is dry or cold environments, I would suggest them to always, or all persons who are exposed to dry cold environments, to use saline sprays or even moisturizers like Vaseline just to instill into the nostrils, so that it keeps the nasal mucosa moist and prevents the crusting and formation of bleeding. That is one. Second thing, avoid alcohol or smoking, which are trigger factors for epistaxis. Persons who are already having bleeding disorders or cardiovascular disorders, it is important to routinely check the blood pressure so that it should not exceed and produce bleeding. And persons who are already taking blood thinners, they need to check their blood parameters on a regular basis, because if that gets elevated, that can also produce epistaxis. So these are some of the simple measures which can be used as prevention to prevent epistaxis.
Thank you so much, doctor. That was very informative. So I hope this was a very informative and enlightening episode. For more such informative episodes, watch BMC Global Live AlHilal Health World every Tuesdays at 8 p.m. And this is Kevin P. Abraham signing off from BMC Global Live AlHilal Health World. Good night.